grab my scenario. My scenario says Q is, he has an open wound on his left arm from 5 days ago. The PT plan of care is to assess vitals, which consist of heart rate, blood pressure, and respiratory rate. Okay, so now I have my scenario, I know what it is. Do I know which arm I'm assessing blood pressure on?
Right side.
Right side. Okay. So if it's me, I'm going to draw a big R on my paper and circle it so I know what the right side is. Okay, and I know that if it's his right arm, I need his chair set up here. So if I want, I can go grab a chair, get my area ready before I even go grab Q from the waiting room. Okay. Alright, so we're starting our comp. I washed my hands. Alright, Q saw me wash my hands. Alright, Q, I'm Dr. Ledford. I'm going to be your physical therapist today. We're just going to do a couple of things before we get started with your treatment. Those would be assessing vitals. So we're going to look at your blood pressure, heart rate, respiratory rate, make sure everything looks good. Sound good? Okay, do I have permission to treat you and work with you today?
Yeah.
Alright, if you can, follow me. He's got shoes on. We're safe. His scenario doesn't say anything about violence or issues, so gait belt isn't necessary. We're going to walk over here. I'm going to have you have a seat right here for me. Okay. And if I'm super nervous, maybe I start with respiratory rate, because that one's pretty easy, right? So I'm going to grab a stool. Okay. Alright, so I'm going to be kind of in close quarters here so we can take some of these vitals. You just get to sit here and relax, okay? Alright. So first I'm doing respiratory rate. I'm going to let Dr. Reed, my evaluator, know that we're doing respiratory rate. Obviously, Q knows that we're doing respiratory rate as well, okay? But I'm going to tell him that we're not doing respiratory rate. So I'm going to tell him I'm going to check your pulse. Okay, I'm just going to put my... Yeah, it's fine. I'm just going to have your hand here. You can relax. I'm going to check your pulse for a minute. Okay, so you just kind of sit and relax as normal. Okay, I at that point would tell Dr. Reed, okay, I either have my phone and I'm hitting the timer, or we're going to start at the 9. Okay, so we're going. Okay, so I assess for a full minute. I'm watching him breathe. Okay, if you have really shallow breathers, figure out if they're if their abdomen is moving more, if their chest. Okay, so right here I can see Q's chest moving. I'm just going to watch that. Okay. So it's been a minute. I then tell Dr. Reed I got 17 breaths per minute. Okay, and she would say, okay, I got 17 as well. All right, so we're good. We're good to go. Write it down somewhere. Write that down on a piece of paper because you need to be able to document it. Okay, so 17 breaths per minute. All right, Q, so your respiratory rate. I was actually watching you breathe, so I was being a little tricky there, okay? So your respiratory rate is normal. We're going to check some other things here. Okay, so we're going to check your pulse. Same thing, let Dr. Reed know I'm checking the pulse. We're going to go on radial. If neither you or the evaluator, Dr. Reed or I, cannot feel on radial, at that point I will allow you to use carotid, but if I feel it strong and you're like, I don't feel it, then, you just need to find the pulse, okay, because it's there. Alright, so we're going to check radial, okay, and again I let her know when we're starting, so we're starting at the 12, okay, and then we're going, okay. So I'm going to assess for a full minute, okay. After that minute, I'm going to tell her 62 beats per minute, okay. As long as she's within 5 above or below that, so if she's 57 to 67, you're good, okay, so a 10-point swing, that's pretty big. Document the rate that you just told Dr. Reed, but also the regularity, okay, irregular versus regular, and the amplitude, okay, like Q I would say is probably a 1+, not super bounding and strong, but it's obviously present. So you need that for documentation. All right, Q, lastly, we're going to check your blood pressure. Since you have a wound on this arm, we're going to check it on this right arm for you. You're just going to lay it there and relax. I'm going to grab the blood pressure cuff. Okay, so Q, we're just checking your blood pressure. Kind of tells me some things about your heart and how you're doing. Also, if it's too high, we don't want to do treatment today. So we want to make sure it's a safe range for treatment. It will get a little snug. I'm going to inflate it. It's going to get snug, so if you'll bear with me, I'll deflate that pretty quickly, and it should feel okay. Alright, so then same thing, gonna check his blood pressure. Okay. So you position yourself what's comfortable for you. Okay, Dr. Reed and I will work around that. If I need to come lay behind him on the table to see it, it's fine. You get comfortable where you need to be. Okay, so for me, I'm gonna be right here in front of Q. I can see it. Okay, we'll move this or position it if we can't see it from where you guys are doing it. Okay. Okay, so it's gonna get a little snug here. Okay. Okay, so check your blood pressure. Okay, so again, inflate it, deflate slowly. Okay. Check my numbers. Alright, so Dr. Reed, it's 118/76. Q, that's great. That means you don't have any high blood pressure, no issues, and we can work with you today. Okay? If it's really high, take the time to educate him on potentially what that means. Okay, not scaring him and trying to use layman's terms. And then make that part of your, if you educate the patient, make that part of your objective. Okay, so educate the patient about this, and I did it for 3 minutes. Okay? And if he was normal on everything, your assessment can state that. Patient vital signs, normal, blood pressure, respiratory rate, heart rate, etc. Patient noted to be in good physical health or has good cardiovascular, cardiopulmonary function as noted by the vitals. Okay? If not, then tell me what was abnormal with their vitals. If the respiratory rate's really high, document what the term is for that. You know, if it was the patient told you they had just come from a workout or they were really stressed, you can put that on there as well. Okay, you can tell me the reason why if you know why it's abnormal. Okay, and then plan. Again, you guys kind of use your creativity for plan. So then I would tell Q that we're done checking vitals today. He's good to do treatment, and then you know he's not actually doing treatment today, but check your vitals, good to go, and then we'll see you next time. Okay, so really doesn't. I mean, this could be a 5-minute comp. Okay. All right. Any questions about that? I never had to take a shoot.